Hello everyone, welcome to the Ghanaian Doctor. Today we're going to talk about herbal preparations and kidney health. What are herbal preparations? Herbal preparations are any medications that are gotten from herbs, gotten from trees, gotten from stems. We all know that food is medicine. So if I eat my guava, if I eat my carrots, if I eat my cabbage, I know I'm taking in medicine. We all know that. We all know that if you're taking some ginger and some garlic, it's really healthy. However, when we go beyond these foods that we all know and go to the bush, go to the stems of plants to cut and grind them and boil them and sieve them into a preparation, that is what we call herbal preparation. So this goes just slightly beyond the range of the food we usually eat to something a little extra. Now, herbal preparations work, okay? I know certain herbal preparations are good for treating typhoid and good for treating malaria. I am in no way saying herbal preparations do not work. A lot of orthodox medications that we use now actually have their basis and their source from herbal preparations. Some of them, for example, morphine, which you use for pain, was gotten from plants. Okay, some of them were used as herbal preparation, and later on because of technology and advance in knowledge, they were reformulated and repackaged into very nice bottles and really nice capsules, which you use daily to achieve whatever we need to achieve in a health setting. So, by all means, herbal medications work. The problem comes with the dosing, the amount of herbal preparation that you need to take. And the problem also comes with the indication, the reason why you are taking a herbal preparation. Let's talk about the dosing. The amount of herbal preparation to take to cure a particular disease, that is the question to ask. If taking 5 spoons can cure your disease without causing any kidney problems, without causing any liver problems, we are happy. But if 5 spoons can cure your disease and then afterwards it leaves with a kidney problem or a liver problem, that is where we draw the line. That is where we are worried. So that is the only issue that we have with herbal preparations. How much dose is being given for the particular indication that is being recommended for? So, for example, I know a client of mine I saw a couple of weeks back who took 5 bottles of herbal preparation to treat typhoid in 2 weeks. 5 bottles, each bottle is like 500 mils. I'm not saying that this is impossible. I'm just saying that in those situations, what is the limit for the person to take before there is risk of liver or kidney disease? When the person takes in that herbal preparation, is it cleared by the liver or is it cleared by the kidney? How is it cleared? Does it is it changed to any metabolites? Is it changed into any other medication in the body? How does it work? Is there any problem that it leaves the body? Does any component of it stay in the body for a longer time? After taking the herbal medications 2 or 3 years later, or even 2 months later, if the person wants to take the same medication again, does the person have to take a lower dose, the same dose, or a higher dose? These and many other questions are what we usually ask. Some herbal preparations have been well researched. For example, the Mampong Research Institute has a lot of herbal medications that it recommends with its stamp and its logo that these ones have been researched and are safe, for use in certain individuals. If the herbal preparation has been researched and is safe for use, if you have a kidney disease and is safe for you, then that is different. But if the herbal preparation has not been researched and you don't know exactly the amount is necessary to cure whatever ailment or infection you have, and you have a kidney disease, I do not recommend it. I do not recommend it because, especially in kidney disease, if you take these herbal medications, the medication can accumulate in the body if it is cleared by the kidneys, and this accumulation can further injure the body. Most medications are also cleared by the kidney, and when there's a kidney disease, they can accumulate and this can harm the body. If you are taking herbal preparations, please make sure that it has at least some, certification or some logo, some embossed logo of either the Mampong Research Institute or the Food and Drugs Association or any other research institute which you can trust. This is important so that we prioritize our lives, we prioritize our kidneys, we prioritize our livers. Let us not just embrace these herbal preparations because one or another person is recommending it. Let's only accept it because we know that it is safe for us. Please, Ghanaians, we like this where because one medication is working for our friend or our brother, we recommend to ourselves. that same medication be given to us. Please, not every disease is the same, and even for the same condition, not one medicine works the same as the others. Different medicines work for different conditions. Different medicines work in different situations. Do not take someone's herbal preparation that because that preparation helps the person to treat his gonorrhea, his typhoid, his malaria. Then, if you have this infection, you're also going to carry this herbal medication and drink it. Please, let's be serious about the medications we take into our bodies. As much as possible, make sure that the medications you take have been approved by either the Mampong Institute of Research or any other credible regulation body. Okay, so that is the little I have on herbal medication and kidney disease. The most important point to pick from this lecture is that please, herbal medications may work, but make sure that when you take them, it doesn't give you any long-term problems. Think of your kidneys, think of your liver, and think of your body. This is a Ghanaian doctor. Give me a like and a follow. Catch you on the next one. Take care and bye.